Hello, today we're going to cover some test-taking strategies as well as take a little time to discuss test anxiety. The objectives for this lesson are to identify common mistakes made during test-taking, to identify behavioral obstacles, so some of the things that maybe we can control and change as we're taking tests, versus just the knowledge base, just not knowing the information. Okay. And then we'll talk about some different strategies that you can use while taking tests. And then, like I said, we'll discuss a little bit about the test anxiety that we seem to all have to some degree. So the best thing you can do is prepare well. So this, you've probably heard this before, don't procrastinate, don't wait till the last minute. But, right away, as soon as you've had your first lesson on that topic or in that content, you want to start reviewing your notes. Look at your syllabus to find out when your exams are going to be, what objectives may be covered in that exam, what type of exam it is. But, again, you should not be waiting till the last minute. Try to schedule a regular time slot for your study of that topic, and so that you won't be kind of blindsided at the last minute. Reviews. So reviewing, much more than reading and rereading your notes or your assignments. So you do need to look at your lecture notes, try to link them to your textbook, and get a little deeper information from the textbook, because obviously if they're in your lecture notes, your instructor feels that those are important things to know. It's always great to have a study group where you can reinforce some of these topics and talk about it. If you teach other people or if you verbalize the things, it's much easier to remember them. We already talked about not cramming at the last minute. The other thing is, if you're cramming at the last minute, you don't want to do it for a long period of time. Break up your study sessions with whatever breaks. If I study for an hour, then I can have a cup of tea, or if I study for another hour, I can go for a walk. Just do things so that you don't get burned out, because once you start getting fatigued, you're going to remember less and less. Self-assessment, which is another lecture that we'll have, is very important in studying for exams. So again, not just breezing through your notes or breezing through the book or anything like that, but self-assessing. And so as you can go through your topics, and maybe as you're going through your lecture notes, on the side, write some test questions for yourself, or try to just list the main topics so you can go back and quiz yourself. This is also where a group or a study partner comes in handy, where you can quiz each other or question each other. There's all different types of techniques for studying or memorization, if that's appropriate for that class. Flashcards is a very popular and helpful way. So, common pitfalls before the exam. Some of the things I've already mentioned, but in addition, you don't need to keep going over things that you already know. If you have a topic that you feel very, very comfortable with, you don't need to keep pounding that into your brain. Go on to the things that need more of your time and need more of your attention. There's also some things that you will never get, and this is not to discourage you from studying everything, but say there's maybe just really very specific details about something that just don't make sense to you. Either need to find a way that it does make sense to you, whether that's through your own studying or maybe getting help from an instructor or a classmate, but rather dwelling on that, again, moving on to things that are going to be more constructive for yourself. The other things to do prior to an exam is prepare mentally. Okay, think positively. Don't engage in mental or negative mental dialogue. If you continue to tell yourself, I'm going to fail, I know nothing, I don't know anything about this, unfortunately that's likely to happen. So just go in it, you know what you know, and I know this and I know this, so I'm ready for this exam. Be sure to prepare physically as well. Make sure you're getting plenty of sleep, plenty of rest. that you're eating well, you're exercising, you're hydrated. So that stuff doesn't make you fatigue and kind of decreases your attention that way. Right before the test, rather than trying to cram this information into your brain, do some things like meditate, listen to music, whatever it might take for you to kind of go to that happy, relaxed place before you take an exam. And once again, I don't even need to say it, but avoid last-minute cramming. Okay, now we've got the exam. During the exam, make sure you read the directions carefully. Sometimes people will not read the directions completely and unfortunately miss some questions because of that. It's often nice to just kind of do a quick glance of the entire test and look at maybe some of the questions that are either easiest for you to answer or the content that comes easiest to you. If you get that, you kind of, build some confidence. I kind of got this. Okay, I know this, and then hopefully you've saved yourself a little more time for some of the more difficult questions. I don't know where this often happens, but it may happen in some licensing exams, is that you are penalized for incorrect responses. Make sure that you know that before you go into the exam, because you don't want to guess on something that you could possibly get penalized for. If essay questions are part of the exam, in the margin or maybe on the back side of a page, kind of write a general outline or your main points that you want to hit in that essay question. Make your sentences complete, very clear, make sure they're neat so that your instructor can read them. And make sure you take some time at the end of the exam to review. Make sure you've answered all the questions. Make sure if you're using a bubble form or a Scantron that every answer is bubbled in and not just on your hard copy exam, because students have been known to miss some of those, and that's very unfortunate to miss points that way. All right, taking the exam, you're going to read the question. So we're addressing primarily multiple choice questions here. So you need to read the question and understand what the question is asking. You're going to pull out keywords that you need to answer the question. If the question is about blood pressure, the fact that the 78-year-old woman has a standard poodle is probably not necessary. But look at, what is important. The age, her activity, what her blood pressure has been before, or whatever you think you need to answer the question properly. Make sure you pay attention to the qualifiers, so those questions that say never, or the least, or the most, those kinds of things. You may want to circle that, or highlight that, or underline it to make sure you don't forget that qualifier is in the question. Same as these strategic words are all kind of the same and can throw an answer off if you don't read that carefully. Before you look at the answer options, try to anticipate the correct answer. Can you answer this question? If you're dealing with patients or a diagnosis, see if you can kind of visualize what this patient looks like or how this condition would present. Okay, and try to come up with that correct answer. Then you're going to address your answer options one at a time. So you want to keep them hidden or don't look at them until you've tried to answer the question on your own. And then you're going to read each answer option one at a time. You're going to look at the first one, so let's say it's A, and you're going to either rule that option in or rule it out. Is that a viable answer to the question? Yes, you'll rule it in. If it's no, then you'll rule it out. Then you'll go to the second option. Do the same thing. You'll rule it in and rule it out. Most likely, you'll go through all the options and come up with two answers. Okay, two that you've ruled in, two that could be viable options. Then you're going to go back to the question. And each of those two answers, so let's say you chose A and C to rule in. So you'll ask the question and then put in answer A. Does that make sense or does it not? Then you'll put in answer C. So you ask the question again, put in answer C. Does that make more sense than answer A? And then you choose between the two on which of those responses makes more sense for that question. It's a bit of a process, but if you practice taking tests this way, it'll come very easy to you. Once again, I'm going to say avoid that mental dialogue. So try not to read too much into the question. Everything you need to answer the question is present in the question. Okay, you shouldn't have to dig too deep. Of course, you're going to be looking back on, your studies, your lessons, maybe even some of the application with these questions, but you shouldn't have to dig so deep that you're having to pull out different answers. If you don't know it, you've gone through all the answer options, mark it somehow, and then go back and address it again. There may be something else in the test that could give you maybe somewhat of a hint, or maybe through going through the rest of the test, somehow that answer comes back to you. So don't dwell on it. If it's not coming to you, especially within that 1 minute, definitely move on. So common mistakes, not reading the question completely. Okay, make sure, even though you've read half the question and you think, oh, I know this, let me choose an answer. There may be a qualifier in the second part of that question, or there may be something added to that question that changes the first part of the question. So be really careful that you read the entire question. Not reading the answers completely, same thing. Whatever the answer may be may also have a qualifier towards the end, or it may have wording that changes the answer just enough for that option to be incorrect. Be careful with clinical experiences. Now, it's good to reflect on those and say, okay, remember when I did this, this is what I saw. Then take it the next step and say, this is what we learned about it in school. Because you're going to see so many different things in clinic. Everyone does things a little bit differently. You need to go back to what you know, and that's what you were taught in your program through the textbooks. The textbooks that we study from in the programs, most of those are used to create the exam questions looking at the board exam. Specifically there. Sorry, I didn't clarify that at first. Selecting a plausible answer without looking at all the options. Make sure you go through all 4 or 5 options to rule them in and rule them out. Don't pick something right off the bat until you've looked at all the other options, because you may find a better, more appropriate answer. Overthinking. This is what I just said. Don't read too much in the question. Everything that you need to answer the question is going to be there. So don't dig too deep. Not understanding or being able to justify your selection. Of course, when I said, you may come down to 2 and you're going to pick the one that makes more sense. If you have time, you do want to be able to say, okay, this is why this makes more sense, so that you can definitely confirm that that's going to be your answer. And I've already mentioned this. Don't read too much into any of the questions or the answer options. So at this point, we're going to take a little break. I want you to read through these common mistakes and maybe reflect a little bit on some of your test-taking habits and whether you fall into any of these and maybe tend to rush through things or not read things completely. And then we'll continue with the rest of this lesson on a separate recording. Okay, thank you.